What are the most effective treatment options for addiction?
Addiction treatment is multi-pronged. So you definitely need, some level of biologic treatment that can be helpful for something like opioid use disorder. We haven't talked a lot about opioids in the time we've spoken, but they are some of the most addictive substances from just how much of a dopamine stimulation can be had from them. But for that specifically, there's methadone, there's buprenorphine, which are types of medication treatments. They're called medications for opioid use disorder, or MOUD. They used to be called MAT, which was medication assisted treatment before, but the more current terminology is MOUD, which is medications for opioid use disorder. There's another medication called Naltrexone that can be used in opioid use disorder, also alcohol, and does help in multiple other areas, including food addiction in some ways. So people who have compulsive eating. And so Naltrexone can be another form. Both buprenorphine and naltrexone come in long-acting injectable medications, which means you can get one injection for a month or longer. And that can be a nice way to have a medication on board for those conditions without having to make the decision daily to take it. And then you definitely need continued what is called psychosocial treatment, which is developing connection with others, engaging support, being able to have a supportive social network, because often people who use are either isolated or the people that they're connected with are also using. So finding healthy or healthier connections and community, which is where I think that AA component or smart recovery, some of those peer support models of recovery become very valuable, because oftentimes people can then find others who are in recovery or at least in sobriety to hang out with, have social connections with, and realize that it can be done. You see like 10 other people who are from your neighborhood or, in similar profession as you who have achieved sobriety, and that can be very helpful. I'm a physician, and so there's a specific physician-focused AA. And so when you go to those Caduceus AA meetings, they're all fellow physicians.
Right.
And so you suddenly see, it's not just me. There's so many of us who are in recovery. So I think there is this element of being seen and supported. If you have other physical health conditions like pain, or you're in distress for something else, that also needs to be treated often alongside. So taking care of your physical health can be part of that recovery component and getting treatment for addiction. We see that a lot of people will give up their normal primary care visits or their executive physicals, et cetera, while they're in their throes of using, because everything else sort of disappears. And so being able to go back to care and learning to love yourself and know that you deserve the care is important. And as a psychiatrist, I can't finish the list without mentioning that other mental health conditions, which are co-occurring, like depression, anxiety, PTSD, other trauma activation, ADHD, all of those also need to be treated at the same time so that the drivers of addiction can be addressed. So it is a multi-pronged approach, and something that really needs a holistic understanding of the person, their life, and everything else that pours into them being well.